In our last video, we discussed how our brain can make us ill through activity of our nervous system and several hormones that are activated when we experience stress. We define stress as a mentally or emotionally disrupting or disquieting influence that causes an effect upon our body. We discussed how excessive activity of the autonomic nervous system growing out of life stress can cause acute and chronic disease. We also discussed how various hormones are produced in excess when we face unresolvable stress, and how these hormones can cause disease. Many authorities believe that as much as 70% of chronic degenerative illness may be related to chronic stress and our inability to deal with it effectively. Part of the problem lies in the nature of our society. Competitive forces push us to work too many hours, make poor food choices, sleep too little, or to take some chemicals that make us relaxed and others that make us more alert. Our tanks are often quite empty, and the life stresses keep coming at us in a constant barrage. A host of clinical studies have shown that chronic stress without relief leads to an increased risk of infections, malignancies, and heart disease. Many studies in laboratory animals have shown this, and most human studies have demonstrated the same thing. Why are some people more vulnerable to stress disease than others? Some of the answer is tied up in the soul and the spirit of the people as they interface with their bodies. Many years ago, Dr. Meyer Friedman identified various personality types in groups of people. There were the hard-driving type A people and the lower-keyed type B folks. Over time, it became apparent that the type A people had more acute and chronic disease of various types than did the type Bs. Eventually, the type As were divided into subclasses in an effort to understand how some type As were more vulnerable than others to the development of illness. The point of these studies is that even our personality, which is related to our mind, our emotions, and our will, can influence our nervous systems and hormone levels that influence our overall health. Well, you might ask, can a personality be changed? The answer is probably no, but those with intense personalities can certainly understand their risk and make other adjustments that make them less vulnerable. Well, what type of other adjustments may be made to help in coping with stress? The first coping mechanism for all of us would be for us to remove some or all of the stress by changing the circumstance. With many of the chronic stress-inducing events discussed in our last video, however, the removing of the stress may not be practical or possible. But there are several things that we can do that may blunt the effects of stressful situations upon us. They are, first of all, increase physical activity. In a study done many years ago, 3 miles of walking per day were equivalent to 25 milligrams per day of the very best available antidepressant medicine in treatment of anxiety and depression. We've already discussed physical activity in great detail in this series. It turns out that activity turns on the parasympathetic nervous system, which blunts some of the effects of the sympathetic nervous system stimulated by adrenaline during times of stress. The more parasympathetic nervous system activity, the less the effect of stress in stimulating the sympathetic system. Physical activity has many benefits, as we know, but one of its most important is blunting the overactivity of the sympathetic nervous system brought on by life stress. Secondly, we should have good quality sleep. Time for good quality sleep is critical to health. Whole textbooks of medicine have been written about sleep. Suffice it to say that chronic anxiety often leads to inadequate sleep, quality or quantity. More people are staying up later and later at night to be able to do their work and are trying to get by on less and less sleep. This ultimately causes overstimulation of the sympathetic nervous system and results in a faster pulse and higher blood pressure. With decreases in quality and quantity of sleep comes increased production of cortisol, which we discussed in our last video. High cortisol levels lead to suppressed immunity and then increased risk of infections and malignancies. Conditions like obstructive sleep apnea, which is often caused by obesity, may also cause disrupted sleep, activation of the sympathetic nervous system, and rise in blood pressure, skipped heartbeats, and increase in blood cortisol levels. Poor sleep is a metabolic accident ready to happen. One of our coping mechanisms for dealing with stress must therefore be to seek what is called good sleep hygiene. This includes not watching TV in bed, or eating in bed, or doing office work in bed, or not watching scary movies or exciting athletic events immediately before going to bed. Number 3, good nutrition is critical. We've already dealt with the importance of good nutrition in our previous videos. Suffice it to say that balanced nutritional density of the right proteins, carbohydrates, and fats, along with enough micronutrients, is absolutely necessary if we're going to be able to cope well with our life stress. A donut and a cup of coffee stimulates the sympathetic nervous system and may actually increase anxiety or certainly not help it. As there are inflammatory foods, there are also non-inflammatory foods. Acid indigestion from overeating or eating acid-stimulating foods can change the way we feel and either increase our anxiety or occasionally decrease it. At the current time, simple carbohydrates are the biggest culprit. Too much sugar and caffeine and alcohol, often taken to relieve stress, may actually lead to an aggravation of the stress response. Number 4, meditation and prayer. Regardless of one's religious affiliation, these are well-known sources of relief from chronic stress. Increased numbers of studies in recent years have shown that those who worship and those who spend quiet time in prayer and contemplation have better long-term survival from chronic disease. Releasing one's physical and emotional problems to God or a higher power has been shown in many studies to result in improved recovery from illness and in enhanced longevity. Carrying the burden of chronic stress, regardless of the cause, is a heavy load, and it can be lessened with our spending quiet time in poetry, scripture, great music, and meditation and prayer. Obviously, there's a place in the management of stress for professionals in the mental health community, especially when the responses to chronic stress exposure are great. Nevertheless, quiet time, meditating on the great thoughts of those who have experienced stress in their lives and have received relief, is often of great comfort and may give us relief from anxiety and other stress symptoms. The Psalms of David in the Bible, to me, are an invaluable resource for those of all faiths in this regard. Medications may be important. There are now a host of chemicals that are available through healthcare professionals to treat symptoms related to chronic stress. They may be very helpful as an adjunct to the behaviors already discussed in helping to reduce symptoms, which usually are the result of uncontrolled overstimulation of the sympathetic nervous system. Millions of Americans take such medicines to treat symptoms growing out of their uncontrolled stress. Many of the medicines are quite helpful, but almost all of them have known side effects, some of which are nearly as bad as the anxiety-related symptoms that sent them to the doctor's office. Suffice it to say that there's a place for these medicines and those that will continue to be produced in the future. At the current time, we have no easy biochemical, physiologic, or structural tests that let us know when our stress systems are out of balance. At Health by Design, we have usually asked our patients to fill out questionnaires that let us look at whether they're at increased risk for the development of stress-related illness. They have been developed by mental health professionals, and they give us a rough idea if a patient is experiencing consequences of increased life stress. It would be nice just to measure a serum cortisol or adrenaline level, but these studies have too much variability in blood levels in different individuals in different times of the day. It is difficult to diagnose stress exposure or response to stress with a questionnaire. We'll likely go on asking patients to complete the questions because the answers at least give us a chance to teach how our stresses may harm us and what simple things we can do to decrease the associated risks. This video completes our first series on how to stay well. It is my sincere hope that those who have watched the videos will have heard a few ideas that will have enhanced their health awareness. Living healthfully is a challenge for all of us. It is not easy in this stress-filled world in which we live. We have to take bold steps to reduce our stress load, even if it means giving up some of our financial and sociologic goals. Our job is to take care of what we are given well. I leave you with a brief word from the letter to the Philippians in the 1st century that I find to be a fitting ending to a lesson on stress and stressful living. It reads this: "Be anxious for nothing, but in everything by prayer and supplication with thanksgiving, Let your requests be made known to God, and the peace of God, which passes all understanding, will keep your hearts and minds. In our stress-filled world, peace sounds awfully good to me. Blessings to all of you.